So I thought I would demonstrate the treatment technique that I used for improving mobility in the lower pelvis. And so she's lying supine. I cross the right leg over the left and I just stretch the hip abductors. And I do that for 2 minutes. Then I stretch the adductors on the right hip, and I impart a little bit of inferior traction while I'm doing that. And I hold that for 2 minutes. Can I have you on your stomach now? And these are all very gentle stretches. There's also a rotational component to this pattern. And so I stretch the right hip into internal rotation, 2 minutes. I then stretch the left hip into external rotation for 2 minutes. Now, did you feel a distinct release with the hips?
Yes.
Okay, with the hip stretches you did. You also said so with the coccyx.
Yes.
So then I find the coccyx again, and I capture the ligaments and soft tissue on the right side of the coccyx with the palm of my hand, and I just engage those very gently, and I push them to the right, and I do that for 5 minutes. Then I isolate the left side of the coccyx, and I push that to the right for 5 minutes. Now, with this pattern, there oftentimes is a lower pubic rotation in which the lower third of the pubic bone is posterior, and there's a lack of PA spring mobility through the ischium. And for that aspect, I treat it by taking a piece of foam and placing it under the left ischium with the client supine for 5 minutes. Now, she did not present with that pattern, but I thought I should mention that sometimes that does occur. Okay? So what did we accomplish? The tailbone is now symmetrical. So she no longer has a deeper sulcus on that side. The ischial tuberosity is more symmetrical, but it's not symmetrical. There's still a degree of asymmetry there, which I probably will not be able to change. And now when I capture the outside of the left ischium, I can load it, and there's movement. I can take up the slack, and I can also spring it. And the same thing occurs on this side. Let's have you lie on your back, please. What surprised me, if you'll capture her foot, was the gain in internal rotation. So now I can take her to almost, well, that's certainly 30, almost 40 degrees, and there's a softer end feel there. So that's a surprising and pleasant gain. That makes me happy to gain that hip rotation. And I'll show one more thing in sitting. Would you come sit and have your feet together? Now, I believe that she has a developmental asymmetry of her pelvis. I don't believe that I can gain any further symmetry of the lower pelvis. And in sitting, the right tibia is taller, and ever so slightly the right femur is longer. And what we found was that placing this soft foam roll, we call it, it's a sacral dowel, placing that under the left trochanter improved symmetry of sitting. This now looks a little bit longer. So basically when you sit on a chair, it's trying to force symmetry on your body. But you have a developmental asymmetry. And so this recaptures that pelvic asymmetry to a degree. Okay? And how do you feel with it under the left side?
It feels supported. Yeah, I feel like I am supported.
Okay, alrighty.
Yeah.
And then when you put it under the right trochanter,
It feels awkward and it feels like I'm sitting on a big lump.
got it, yeah. So I suggest that you do an experiment with this, so use it today whenever you sit more than a half hour at a time.
Okay.
And then tomorrow let me know what you think. It sounds really positive.
Great.
And it might be helpful for long-term sitting.
Wonderful.
So what we'll do is we'll stop filming and then and I'll see you again tomorrow.
Thank you.
Thanks.